Okay, we have a quorum. Call the meeting to order. First item of business is approval of the March minutes, which you have in your packets.
I like the font. We'll just go with that.
You what?
I like the font.
Microsoft updated, and that's what it updated to, so I just left it.
So any additions or corrections to the minutes? Is there a motion to approve?
I'll motion to approve.
Second?
Second.
All in favor?
Aye.
Opposed? Thank you, the minutes are approved. Health officers report?
There were 2 COVID-related deaths in Wayne County in March, and our 7-day average is only 3 new cases. It's down all over the state, and you can see this by measuring COVID and wastewater, and hospital admissions are down. RSV is dropping across the country and is minimal to non-existent in Wayne County. Influenza is minimal. Nationally, there's been a measles outbreak in, I think, 18 states. And these are all basically related to unvaccinated people. The avian flu, and this is kind of an alarming thing, has infected dairy cattle. It may have infected beef cattle, but the dairy cattle are around people all the time, and there was a transfer of avian flu from a cow in Texas to one of the people working with the cattle. I don't know if it was a workman or the owner of the herd. Mainly just had conjunctivitis, but typically people that get avian flu will get flu-like symptoms or conjunctivitis, inflammation of the eye. So we haven't seen any of this in Wayne County, but this always is unnerving to me when we have crossover diseases between species, because we know avian flu obviously can pass to chickens, but going to a mammal like a cow seems is alarming. There's concern of the CDC with meningococcal disease, and there's been a national increase in meningitis. It can be vaccinated for. This is something we need to encourage people to get. All 11 and 12-year-olds should receive this vaccine and a booster shot at age 16. And that's the gist of the executive director's report, or the health officer's report.
Any questions? Yeah, I think probably wastewater is, as far as COVID, is the best measure now. When people are testing at home and not reporting, and so I would assume it is our best indicator.
I think there's so many people very symptomatic, and you're right, people that have it and not reporting. But I think the good news is that, especially those of us that have, well, we've all been here, right? The past 3 years, this is a lot better than saying we've got 80 people in the ICU, and we'd be excited because this week only 10 were on respirators. That was a horrible time. So I'd much rather prefer giving these kind of numbers.
Okay, clinical director report.
So our Health First Indiana request for proposal was posted on Saturday so far, we've received requests for application materials from 9 different groups. I don't know, do you want me to tell you who they are, or should we wait until after the 30 days to share that information? I don't know that
I
necessarily
think it'd be
matters.
interesting for us to see who all wants to participate in Health First.
Okay. So we've received requests for application materials from the Boys and Girls Club, Neighborhood Health Center, Reed Community Benefit, Birth to 5, the Wayne County COAD, Bridges for Life, Oak Park Early Learning Academy, Meridian, and Communities and Schools / Young Achievers. So kind of broad across all the different 7 core service areas that we're trying to.
Nothing from Reed though?
Reed Community Benefit, yeah,
Oh,
is on there.
Reed Community Benefit,
Yep.
okay, that's Reed.
So this is good, you know, you never know who's wanting to collaborate with you, and having 9 applicants, that's a good thing.
Mhm, yeah. I don't know of any others specifically that will request the materials, you know, that may just be waiting on something. But yeah, I still think 9's really good. Let's see. So the next thing is the budget draft. So in your red tab, you've got 2 different documents. So our 2025 Health First Indiana budget is due for our first round of submission to the state on June 1st. And so because of that time frame, I wanted to make sure I submitted a draft to you guys to look over for this meeting, so that I can make the appropriate changes next month and then have it approved by the commissioners and the council before June 1st.
By you guys, you mean
You
the board?
guys, yes, the board. Let's not make a comment on it. Okay, so I have a summary page, the 2025 budget basics, the red tab, that breaks down essentially what I did between the Wayne County Health Fund and the Health First Indiana Fund. So I had to get some guidance from the Indiana State Department of Health because of us having a range to expect for our 2025 funding from about 1.5 million to about 2.1 million. And they suggested going with the smaller number and then kind of made that blanket statement to everyone across the state. So this budget that I'm submitting to you as a draft is based off of the 1.5 number. And then if we end up getting additional funds, because not all the counties opt in, then we'll budget that money later on once we know what that number is. So kind of to summarize what's going on this page here, the first point here on the summary is that I moved all the personnel that was in the Health First Indiana budget from 2024 over to the Wayne County Health Fund. And the reason why I did that is because when personnel are in the Health First Indiana Fund, we have to pay their fringe benefits. And so I gave an example about midway through the page there, what that costs us when they're in the Health First Indiana Fund. So then the next portion there says that the Wayne County Health Fund is now exclusively personnel, and then I'll present a draft to you on that budget too. I just didn't figure that was necessarily a good idea today. So with all the personnel in the Wayne County Health Fund, that comes to a total of $815,000. The 2024 Health Fund approved budget was about $827,000. So that does leave a little bit of wiggle room if we leave it just as is, for a potential increase with a 2025 salary ordinance or just any sort of changes that might be expected. And then finally, the third line there is that all the non-personnel line items that used to be in the Wayne County Health Fund were then moved over to the Health First Indiana Fund to account for the shift of the personnel into the Wayne County Health Fund. And I made some slight increases just to account for things like inflation. And then those other 2 fund numbers that you see there in the middle of that third point, the lead grant and the HIV prevention grant, those are 2 funds that will be going away because of the Health First Indiana funding. So I moved those non-personnel line items over to the Health First Indiana funding as well. They align with the core services. So that's kind of the basics on the first budget draft. So if you would like to go through the numbers, we can do that as well. just so that we can see kind of, the auditor's office gives us State Board of Accounts account numbers, so I thought it would be helpful for us to be able to know what each line item is, and so we know exactly what it is being moved from the Wayne County Health Fund over to the Health First Indiana Fund as far as what the account number is.
How does the county account for maintenance on the building, repairs and that? Because we don't, there's nothing on our budget. This is for that, is that?
Let me see, I can check.
Typically, it comes out of commissioner's budget, I
Yeah.
believe.
Yeah.
It's their
So that's-
building.
So that all,
Yes, so
so
like,
that's a different funding mechanism.
Correct.
we just got that new awning, and that was did not come out of our budget.
So if we do something on the interior, then we pay for it. If we want to repaint or, hang pictures, we pay for it. But anything structural or maintenance-wise, commissioners and Steve take care of.
So I see we're planning to buy a new vehicle.
Yes, so Dan, do you want to comment on that, with it being a fleet?
Yeah, so right now we have one newer vehicle assigned to the clinic side of the department. It is a 2023 Ford Escape. Then we have a 2010 Ford Fusion, and it's got approximately 25,000 miles on it that is not mechanically safe to take outside of Wayne County. Then we have a 2010 Chevy Cruze that's got approximately 85,000 miles on it. So I'm wanting to phase out the Ford Fusion, purchase a new vehicle to replace that, and then either in 25 or 26 phase out the Chevy Cruze and replace it. I'm trying to replace the fleet with nothing but Ford Escape, so we have the same vehicle for everyone, so it saves us money on oil changes. We can buy filters in bulk, tires in bulk, things of that nature. And the county as a whole is trying to standardize their fleet as well. I meet with fleet management Wednesday night, and it obviously has to be approved by fleet management as well. So we're gonna take that money from COVID reimbursement, correct? Is that the plan, or is that?
I put it in here.
We put it in 1161. So it's approximately, I think we budgeted $37,000, and I think the last two we bought for actually $34,000, so we come in under budget for the last two purchases. And we have a lot of these programs go outside of Wayne County. A lot of trainings are not based in Wayne County, so we want safe, reliable equipment for our staff to travel in.
How did you estimate overtime?
Do what?
How did you estimate the amount of overtime?
I believe I just moved it approximately from what was the 1159 budget number from last year. I can look and see here. So it was 2,500. Yeah, so it was a total of $2,500 that was approved for the 2024 budget, and so it's 2,400. Yeah, so it's $100 different from what was approved by the council for the 2024 budget.
Do you know what was spent last year?
I can look and see. In 2023, $1,466. So not even $1,500. So there's definitely a cushion there.
Most of our staff's on comp time,
Mhm.
so they get compensated with time instead of money.
I do think we've spent more on overtime this year so far because we're short-staffed a little bit. When we were contracted with Heartland, we had additional people to be able to do things like work Saturday clinics and evening clinics and the syringe exchange and stuff like that. Only certain people can do those things. For example, only certain people can drive the mobile unit and things like that. So a lot of times we're having to put puzzle pieces together just right to get it to where it needs to be. So I do have, I think, only one employee so far that was converted to overtime once this year. But I don't think it had happened this early yet last year. And it's just a staffing issue at this point. But we're getting people cross-trained and as many people who are willing to drive the mobile unit trained to do that, and kind of, yeah.
I'm assuming the bulk of medical supplies are vaccines.
Yeah, and because of the harm reduction grant ending, those tests are about $20 a piece, $20 to $30 a piece. We spent about $54,000 in medical supplies for that grant last year. Between the Wayne County Health Fund and the Health First Indiana Fund last year, we had $200,000 budgeted for medical supplies. So all of those supplies are in just this one fund versus split between two, like it was last year. But with our 340B fund, we can also buy harm reduction testing supplies like STD tests and STI tests.
If we move forward on expanding treatment of hepatitis C, will we have to have some adjustments to the budget if that occurs, or?
You know, does the board know about the 340B plan and hepatitis C and what?
I think we've heard about that plan. I don't know if we really, you're still in the discussion with expanding services to other jails
You
and
want me
other
to address
counties.
that?
Are people aware of that discussion's been going on?
Well, I can tell from Amanda.
I'm a little refresh, please, I've slept since.
340B, the state of Indiana negotiated with pharmaceutical companies to get a cheaper rate for buying this medicine. This medicine's a pill that's given to the person with hepatitis C, a chronic viral disease, once a day for 3 months. And the patient's cured after that. The person that invented this medicine won the Nobel Prize in Medicine. It's a big deal. So we can get this medicine under this plan and we're reimbursed for it. After the dust clears, the money that we get for treating one patient is $5,400. We've treated 400 patients. We've made $2 million. If you're trying to treat diabetes or high blood pressure, you have to go out and do blood sugars well, as luck would have it, everyone that has hepatitis C, we know where they are. They're in jail. So I've met with Ron and with the sheriff, Randy Ritter, and with Jeff Plaster to see about going into the jail, testing these prisoners and treating them. And my goal is to treat the other 5 counties within our area, the Henry County Jail, the Union County Jail, which only has 8 inmates, the Fayette County Jail, the Randolph County Jail. But when we tested the people in the Wayne County Jail for hepatitis C, and 60% of the people had hepatitis C. We tested the people in the Fayette County Jail, and 85% of those people had hepatitis C. So, one of our mandates from Health First Indiana, this is one of, our criteria is our key performance indicator, KPI, I hate these acronyms, is to lower the rate of hepatitis C. Well, I want to do that, but it's a happy circumstance that, is that for me, Jim? It's a happy circumstance that this turn, that we'll make a lot of money.
Yeah.
We're treating 20 patients a month now that are just walking in and have hepatitis C. That's $100,000. So we're already making $1.2 million a year from treating hepatitis C. So does anybody have any hepatitis C questions? But I think it's important for the board to know this because of what I've been doing behind the scene. I mean, nobody else is there other than Ron and the sheriff. But this is a game changer in that there is nobody in jail in this state that's being treated for hepatitis C. Not an inmate, not a single person. If you Google hepatitis C in jailed individuals, you'll find that nationally, 30% of them have hepatitis C. So we're talking about thousands and thousands of people. Now, normally this is an asymptomatic disease, but in a certain amount of people will die from the disease, either the liver failure or hepatic cancer. So, and the other thing is, you know, our mandate is to protect the public health of the people of Wayne County. People that are treated for this don't give hepatitis C to somebody else. I mean, so if this comes to pass, we will have a lot of money, and we can use that money on anything that's health related. So that's a good thing. Something else I want to address that I think the board should know is, because I don't know if I've ever talked to you directly, is I don't want to, Christine was our executive director, and I don't want to hire another executive director. I want Becca to continue as a clinical director. I want Dan to continue as the environmental director. I've sent job descriptions to HR. Well, I didn't send them, I told Becca to send them. And I want to raise their salaries. And then I ultimately want to hire a third county employee, because these people are getting overwhelmed with this extra work with Health First Indiana. And it would be a administrative assistant, what is that title?
Administrative coordinator.
I never can remember that. Administrative coordinator, but it's somebody to help Becca and Dan. But even after doing all that, eliminating, I've already met with Beth Leisure, the head of the council, and Max Smith, another person on the council, and proposed this, and they were in agreement. They'll end up even if I pay the new person $55,000, they'll end up saving $15,000 a year. It's easy to get concessions from the council if it doesn't cost them any money, I've found. They have an entirely different attitude. So these are the things that are going on behind the scenes. They're all good things. So now you're all up to date.
So,
Question?
just to kind of follow, what are the next steps, or where are we at in the process in conversation with Sheriff Rutter or, you know, the Union County
Well,
Jail, et cetera?
Good, I'm glad you asked that question, because at this point, David Wolf, who's our nurse practitioner, and I are creating the protocol for this. Once that protocol is in place, I think we need to go over to the jail, and you know, whenever you ask somebody something, Amanda, there's always a concession. And in this case, the concession to the jail is that Randy's always wanted a navigator, which is a good thing. A navigator is somebody that follows the prisoner through his jail sentence. They help him write a job application. They help him, you know, they're looking to get housing for him or her after they leave the jail and have a job. You know, the goal is for them not to return. You know, I always think of that scene in the movies where the guy walks out the jail door and it just slams behind him on a dusty street, and he's just there by himself. He's got a paper bag holding his clothing. And that's exactly the wrong thing to do with these prisoners. So I basically told him that I don't think he'll get that money from council, but we have the money. We'll just pay for the navigator. And I just found out from Ron that Becca has written the job description for the jail navigator. And
It's your blue tab.
we will, we'll use that navigator, and I plan to, since we're funding it, I plan to be there when this person's hired. I want to participate, and Ron feels this is right and just. It needs to be a special person, and I hope we can find somebody that has a real passion for this. But I also want him to help us. I want him to, if a patient, you know, most of these patients in jail have Medicaid to pay for this. The ones that don't, you know, I want the jail navigator to sign them up for Marketplace. And I also told Randy, I want to treat everybody in the jail. If there comes a circumstance where we have somebody and there's no way we can get any kind of insurance, I told him that we'll pay for it. We'll just do it. Because we'll generate enough money that we can afford to do that.
Let's move back to the
Sorry, Paul.
budget draft. So I think we'll do is finish discussing the budget draft, and then we'll jump down to jail navigator and then get back on course. But are there any other questions or comments on the proposed budget?
It does end up leaving us with, not say the wrong number here, $836,957 for RFP contracts. So like this year, for example, between the paramedicine and the RFP contracting money that we put out, we had $354,000. So because our money's doubled, it just kind of worked out that it was essentially double, a little bit more than double what we had this year that we'll end up with next year, and that's at the minimum. So we could, you know, this is based off about 1.5 million. We may end up with 1.7, 1.8, something like that. It's kind of what I anticipate based off of the counties that they suspect will not opt in, but we just kind of have to wait and see on that.
What's the minimum the county has to give?
So their absolute minimum is like 351,000, and that's based off of 20% of this minimum. So then if we were to say get the maximum, which it will not happen, 2.1 million, then their minimum is like 400 and, do you remember what I said, 421?
It's right in that range.
Um, But, I mean, absolute scraping the bottom of the barrel minimum, about 350.
I want to ask him for 500,000. And I told Beth Leisure that, and Max Smith. I want more than a minimum. This is important work we're doing, and the money will be well spent.
And something that we kind of have to consider too is if we get, right now I have 816,000 in my drafted county fund. So if we get 500, then I have, you know, kind of the phase plan that I'd have to start moving people over here, and that the state understands this. I've told them how insane it is. I think that this is due June 1st, but they don't really care anymore. But anyway, so depending on what number the county gives us, the state is well aware that we're gonna have to start, everybody's gonna have to kind of fluctuate things between 1159 and 1161, which is state funding and county funding. So, and I've kind of had some conversations with some people, so they're kind of aware of that.
So the next step on this, if we approve it, is to go on to council.
Yes. Yeah.
Any
Council
further questions? Is there a motion to approve it to go on to council?
I'll make a motion to approve.
Is there a second?
Second. Either way.
All in favor?
Aye.
Aye. Opposed? Okay. And then, like I said, we're gonna jump down to jail navigator, since we've discussed that to some extent.
Do you want to go with the job description?
You do it.
Okay, so this is a combination of something that Ken, the director of HR, sent me, and then some things that I anticipated, Dr. Jack Moore wants, and I've had a couple conversations with Randy kind of in the past. So it talks about the recidivism that he was talking about, trying not to have people come back into the jail, assisting with services that kind of reduce that rate. Then also kind of second line, you can see that duty of the Hep C and HIV testing and treatment. And then, below that, you can see where we're talking about making sure that we're protecting their personal health information while also getting them on health insurance. And so I put some information about the fact that this is someone who would report to the health department, so if that's wrong, I'll change that. But is someone that works inside of the jail to assist with jail inmates and kind of works as a liaison through the whole program and connects the whole program together.
I think it's important that they do, they need to have a working relationship with the health department, however that's worded. But I think, isn't that right? They'll be an employee of the jail, Ron? Or will they be an employee of the health department to navigate it?
I think that's up in the air. I think my initial understanding was that the sheriff's comfort level was greater if they were to be an employee of the health department than it would be if it was in the jail. Now, I don't know.
Well, I don't have a problem with that. I think
we're trying to alleviate some of his concerns.
This position will be, this person will be a county employee and will get benefits from the county. And the new position, what is it? Administrative coordinator will also be a county position. And I also want to make, one of the things, in order to make all this work, I'm asking a tremendous amount from David Wolf, the nurse practitioner. I mean, a nurse practitioner in a health department, they're, giving shots and drawing some blood, and they're not going to jails, and I also ran this by council, and the two people that I talked to, and basically, since this plan will fund all of this, they had no problem with it, so.
I'm assuming their assumption is that this money goes away, those jobs go away.
Well, we'll worry about that when that happens.
So is the jail?
Nobody's spending this money now, Paul,
Okay. Right.
except us.
Right.
I think we're probably the only county in the state that's spending any of that money.
Well, I think it makes sense for the navigator to be a health department employee.
I think you're right.
I think it helps reduce silos and increases that opportunity for collaboration between health department and the jail. The question I had regarding the jail navigator position, is this out of the request for proposals funding, or is this coming out of a different?
This would be funded out of our 340B program.
Okay.
So eventually we'll get to this document, which is gonna be our monthly financial report,
Okay.
and it's gonna come out of,
Yeah,
um,
we're awful
Because I can
proud
see
of
how
this.
this meets some of the KPIs.
oh, definitely, yeah.
Yes, so I just,
Mhm.
okay.
I think it's really a big step forward, just
Oh, absolutely.
overall, the community benefit
Yeah,
on multiple levels,
Yes.
not just
Yes.
public health.
yeah.
And it really contributes to the whole ideal of rehabilitation.
Right.
Yeah.
And being preemptive and proactive and not repeating such cyclical processes. I'm curious, is there an ideal salary that you all had in mind, or one you all still have up in the air? Or still
Well, I
discussing?
figured this whole thing with benefits would cost us $80,000.
Mhm.
That's the Dave Jetmore number, I don't know. I don't know what the real number is.
I think it might be a little low if you're looking at a $42,000 cost of what assumes a family insurance plan, but
All right.
$42,000 cost of fringes, and if you have, say, $50,000, I think you're going to be a little more realistic.
Okay, so I'm around. Okay.
And logistically speaking, the stuff I handle, this would require another vehicle. This person would be responsible for, finding housing, maybe getting them to rehab, something to that effect. So it would entail another vehicle on top of what we've proposed.
Which
I guess my concern is that I think we're dealing with, what is the population of the jail currently, about 200 and some?
I don't know.
So is that a lot of work for one person?
It is, and I talked to Elizabeth Hanson about kind of a similar program shell.
Yeah.
And she had said at one point that another hospital who's piloting a similar program, that really it's a 5-person job. They have 5 people that do a jail that is 2 beds different than our jail. So I guess it depends on what Randy expects out of this person. I would imagine we'll have him kind of look over this job description.
You know, we're feeling our way along here.
Oh, I know,
And,
yeah.
you know, we're going in the shallow end of the pool, but we're gonna go to the deep end.
Yeah,
And,
yeah.
if we need more personnel,
yeah,
we'll get more.
yeah, this'll be a scratching at the surface. I mean, the job,
But these are all good points, you're
Yeah,
exactly
the
right.
job
And-
description
And
is-
I think that the short answer is nobody knows.
right,
Until we
Right.
do this.
Right.
How much, until we undertake this is an exciting venture.
There are pending projects that have been identified through the HELP ARPA program, and one of which is related to transitional housing.
Yes.
So it's very likely that there will be community resources available to this navigator, so it's not like a person having to do everything on his own, but it's going to be very time consuming.
yeah.
But there are a lot of exciting potential projects that have been, are in various stages of development through the ARPA and the HELP legacy.
Right. And there are multiple organizations in the community, Centerstone included, where we're pretty much positioned either because we've already had jail programming or we're very familiar with the population to where it's like, you know, creating kind of a linkage opportunity there, more so than that navigator having to do all the work, right? So, okay.
So we don't want to reinvent the wheel.
Right.
So I assume at this point we are where the board can approve exploring this concept. I don't think it's in a forum.
Yeah, I don't think you're telling Dr. Jetmore to stop, cease and desist. I don't think he's doing that.
Not at all.
You want me to plow ahead?
Go
don't you?
forth and prosper.
Do we need anything formal at this point, do you think, or just that there's just
I
a
think
general
this is
consensus
informational.
of the board that this is
Yeah, I
a
wanted
thing
people
pursue?
to know what was going on.
Mhm.
I hope we found that informative.
Mhm.
There are guidelines, administrative guidelines, that the Department of Insurance has adopted, including code of conduct, some ethics issues for navigators, because I see in the job description this person is to be licensed through the Department of Insurance. We'll take a second look at that, because that kind of filters into some of the concerns we heard expressed related to the navigator and referring these folks to the marketplace that do not have Medicaid already. I don't see a problem, and I've got an attorney out of Muncie, law firm's looking at it to kind of confirm it, but I think the more comfort we can give the sheriff, the greater the likelihood that we'll get this pilot off in Wayne County. And I think if we do, I share Dr. Jetmore's optimism that it's just going to be unbelievable. You're going to have counties calling you and knocking down your doors.
Yeah.
Any further questions or comment before we move on to Community Health Coalition?
I think it's just important for the collaboration with Centerstone and the other entities. Because when it comes to insurance, there are other agencies that can easily come in and help with
Yeah.
that piece. So this person does not have to be the standalone.
Not at all.
We're entering into the area of collaboration.
Yep.
You ready for the next thing?
Yeah.
Let me find my script here. The only thing with the Community Health Coalition was I wanted to mention that I tried to have a Community Health Coalition meeting, which is the stakeholder group that kind of gives us input from the community, from the different agencies, for some feedback related to our plan with Health First Indiana. The board was invited, the commissioners were invited, the council was invited. we're getting there.
Okay. I was like, what did I
So,
miss?
before the meeting, I went to get all the materials ready and saw that there were no responses to my meeting invitation. I had this room booked, and anyway, no responses. Came over here, and apparently because of the Outlook upgrade that we've had with our email, my email invitation that had been sent 3 weeks prior never got sent to anyone. And IT's looking into why it happened. They can't confirm why it happened. Jeff Plaster just happened to walk over here while Dan and I decided to have a supervisor powwow since we had the room. And I showed him the invitation, and he said, my name's on there, and it was sent 3 weeks ago. What happened? And I said, apparently no one got it. So anyway.
Promise you did not get it. Okay.
Well, everyone in this room was invited, so.
Okay.
Anyway, I contacted the state. They said it is not a requirement that the Community Health Coalition has to meet before the draft is submitted. So just kind of, so you're all aware there. But I did want to, at that meeting, I had a sign-up sheet for interest in being on the selection committee once we decide to look at all of our requests for proposals. So I was gonna see what your thoughts were on sending like either a nomination form or an interest form of some sort out to our Community Health Coalition to see about a selection committee for our request for proposal review. What are your guys' thoughts on that?
That's the board's thoughts for that.
Yeah. Oh, thank you. Sorry. Condition.
Now, by selection committee, you mean that's who's gonna award grants or recommend awarding grants?
Yeah, so we've got the review sheet that, it's like an objective scale that we went over 2 months ago maybe. So those individuals would be using that form, but then also making the final selection for awarding the contracts, yeah.
Well, obviously, I think the department and the board have to be pretty heavily involved in that. How do you people envision the role of basically we're talking about applicants, what role would they have to be involved?
The way I envisioned it is that, we've got the applications, right, and what they're gonna provide. And it's up to us to decide whether or not we're gonna collaborate with these. Some of them are duplicates. Are we gonna collaborate with Group A or Group B? I don't wanna make that decision unilaterally. I think that should be a board decision or a subcommittee of the board. Don't you?
Yes, I think the board has to be involved, and I think we might divide in half, and so the burden is that you review every single one, but we divide the board kind of in half, and half are given to that section, and the other half to the other to help review.
We had talked
How
about,
long are these applications?
so the budget template is 6 pages long, and I've asked them to fill that out and then just submit like an essay that has all the required information from the prompts that I gave them. So
Well, she can print all these up and everybody can have a copy. There are 9 of them.
Well, how many applications are we talking about?
well, I've had 9
9.
groups
9?
request
Well,
materials.
then I think the
I
entire
haven't
board could
received them.
review, I think, don't you? The entire board could review.
Well, it'd be nice if
Yeah.
every member of the board were familiar with all 9
Yeah,
Yeah.
applications.
so I think go to all the board members with the form and we evaluate it all. I think we can probably do that through email, I assume,
Okay.
with a deadline. Then I think knowledgeable people on the health department staff should also be evaluating.
Well, I'd like, we can, look, I think, I would defer to the board on making the final decisions, but I think Becca and I and Dan would like to have some input.
Well, I think it would be good almost if you, on the first run, you put your input in and we get your input when it comes to us.
All right.
So it's not just back to your input as well as our own.
I have told people as they've requested the documents that I'm not on the selection committee, just so that I can kind of answer questions and feel like I'm in an unbiased situation. So I would prefer not to be part of the selection process, but I'm happy to give, answer questions or give feedback as how it relates to fire services. But I wanna make sure that I'm being transparent about what I've said so far.
You don't feel comfortable giving your opinion about?
I can give my opinion on how it relates.
All right, well, I feel comfortable. How about you, Dan?
I'm comfortable with what relates to
We've
me.
got three
I
comfortable
mean, it's-
people over here, so we'll evaluate them, and then the board can look at it.
Yeah, kind of scoring based on
Yeah.
KPIs
Yeah,
and
yeah.
saying this one meets, yes.
And then if there's one that everybody feels lacking, or there's something that some people
Missing.
feels controversial, then we could even have a special meeting to
Right.
discuss it.
Mhm.
So as I receive them, do you want me to send them to you, or you want me to wait until I receive all 9 that I'm anticipating to receive and then email them to you for review? What do you
What's the deadline for getting them in?
They have to get them in by April 30th.
Well,
I do them,
why don't we wait and get all of them, and then, what you want them to do as they come along?
It depends on,
It might make it easier for you. You want to get them in the form of emails?
yeah,
Well, let's do the ones we have so far, and then make our comments, and then we'll email them to the rest of the board members.
Okay.
Done.
and ask for a confirmation, given you the last email fiasco.
Oh, yeah, like read receipts or delivery receipts
Yeah,
or
make sure
something.
we get them.
Yeah.
Okay. Independent contractor updates.
Alrighty. So, with the, Ron, correct me if I'm wrong, Department of Labor guidance rule that was issued in March, there are kind of some holes in the safety pin, contractor contracts that I drafted. So, gotten some advice, feedback, I guess, from Jeff Plaster, and just thoughts from various people, and kind of come down to 3 different options as far as moving forward with our independent contractors in general. And so the 3 options that we kind of see are revise the independent contractors until we get them right with the updated guidance that happened in March with the Department of Labor. Attempt to get the safety pin employees as county employees through county council, or consider sub-granting. Right now, it would really only be the safety pin grant that we have. The safety pin grant program started on March 1st, but we don't have any contractors doing the work yet, because I don't have a contract to get those people started or get that work started.
How many people are we talking about?
So the safety pin is 2 people. However, we have independent contractors working for the health department right now that don't have current active contracts because of our previous contracting relationship situation.
Pardon?
Yeah. Well, and just because the changes that happened in March and then the issues with Heartland previously, we don't have a current active, accurate contract.
Well, I think, not to speak for Jeff Plaster, but I think I've heard him speak to know that I think his comfort level would be greater if we were working with an independent entity, because at that point, they're employees of the entity with whom we're working, and we really don't have to get into balancing those factors that and you can be a lawyer and practicing employment law and get them right maybe half the time. I mean, the scale has definitely been thumbed to where applying the new test that the Department of Labor has introduced, you're far more apt to come down to the conclusion that you are dealing with an employee than you are with a true independent contractor. Exceptions obviously are the greater the training, professionalism, certification, degrees, what have you, the greater the likelihood that you'll still have an independent contractor, but there's still, you look at one issue and you look at the other. Is this a core function? core function just took on a new meaning with HA 4, you know, so to the extent that it's an essential function of the entity, then it's more apt that people you have do that function are going to be considered employees. The courts, pretty well, they don't care what the Department of Labor says. They pretty well have their own standard, and it's kind of like the judges who have said they know what obscenity is because they recognize it when they see it. That's about as much guidance as they're giving you on this. They call it the economic reality test. Well, one person's reality is another person's dream of fiction, you know. So it's a tough one. I think council and commissioners are more comfortable if you can find independent entities. I think that certainly we're looking at local resources. Reed would be one, I think, that would be in a position to address some, maybe not all, some of the contractual needs.
I know that Reed is applying for their own safety pin contract, so I don't know how that would work as far as like an issue as controversy. One of the things that we've kind of talked about in detail is a large portion of these groups that are applying for our RFP are very relevant to our safety pin funding. And so that's kind of what originally made me think of the sub-granting idea. I have checked with the Indiana Department of Health financial analysts, and they said that there's no reason why we can't do that, as long as we kind of follow all the proper protocols. I also had a visit with the state director team and admin team last week, and I asked them about what their guidance was on this, and they said that they weren't aware of it, and so they're checking with their legal team and seeing what the other people who have independent contractors are doing.
Does your grant require that these be full-time positions?
So when I wrote the budget, I wrote them for contractors, no fringe benefits, but 40 hours, or approximately 40 hours at a certain pay rate, with no fringe benefits.
So when you talk about subcontracting, explain exactly how
Kind
that
of
would work.
like an RFP, but for the safety pin grant alone. So there is no 30-day posting requirement because it doesn't fall under SEA 4, but essentially having, kind of like working with an entity like Reed, having someone else fulfill the grant requirements for us, but someone that's a specific agency that already does that work. So, for example, Birth to 5 would sub-grant the safety pin grant from us and do the safety pin work.
So it would be their employees.
Right, yeah. And we would
We
just.
would just grant them money to.
And ensure the reporting's happening. We would actually do the reporting, but it's almost like we're their supervisor through the grant process.
It'd be a fee for services as far as we're concerned, basically. We'd have a contract.
How doable, that seems like that might be,
It's basically what we're doing with the Health First Indiana stuff. So we're gonna be familiar with the process here pretty soon.
that would seem, to me, that'd be a direction you might want to consider with the safety things. Or would you rather have employees? Good question.
In all fairness, I think she'd rather have employees.
I was just gonna say.
I mean,
She said maybe.
I don't know.
I have to speak for you, but
How feasible is that?
Well, I do think that we're gonna figure the process out, or we are figuring the process out through doing the RFP process with Health First Indiana. So I think that it'll be very similar to that. I think it'll be less complicated because of the legislation with Health First Indiana isn't present with the safety pin. And I have a good working relationship with the people who oversee the financial and the rules part of the grant, so I can just ask questions as we go. Other updates that kind of are related to this, our nurse for FEMA just resigned, and I feel like it might be complicated, and part of her concern before she gave me her resignation information was if we did sub-grant it to someone else and they were in a different building, our safety pin and our FEMA programs interconnect a lot, and so it might be difficult if we sub-grant essentially half of a program. It's not supposed to be viewed that way anymore, but it sort of still is. That's the way it historically has been run.
What would be the most effective way to do this?
Most effective, I think, would be if they were county employees.
And I think that that's what we should try to do.
Okay.
One question, I mean, you've got 2 FTEs in your plan.
Yeah.
Is it feasible to maybe go with 3 part-time, 20 to 25 hours apiece? That avoids benefits.
Maybe I don't have the physical space maybe for them. I have one large office split in 2 for the 2 people right now.
I'm curious to know what that would, and to Attorney Cross's point, anytime you can try and maximize and quantify, but what would that potentially do to the quality of applicants for such a position, if it's part-time versus full?
Yeah, that's a decent point.
And they wouldn't all have to, obviously, at a 25 to 29 hour, 29 would be the max for a county. They wouldn't all be there at the same time. Like, you know, coordinate schedules too.
Yeah, and we could start even.
But
start
that may not, I don't know if that works. It just
Yeah.
sounds like a possibility.
Yeah.
I can tell you for the last FEMA position, we had 3 applicants for the full-time position and 2 for the part-time position. That's all we had applied for that position during the last process, so.
Some people find the part-time possibility attractive if they don't want to.
I think the council might be more willing to agree to it that way.
Well, it seems to me that we're gonna have to adjust some of the contracts we have in the contractors to comply as best we can to comply.
I've given the criteria to Becca, and I think we kind of played with the safety pin contract to get it as sanitized as we could. It wasn't perfect, and probably if it ever were tested, we'd probably be on the losing end of that. And the downside of that is significant, because then you're subject to penalties for not having done your withholding and what have you. So, it's a slippery slope. It's one that this department has dealt with for several years. Just not just with the new administration, I mean, the prior administration.
Well, the council is incredibly resistant to adding full-time county employees.
Incredibly is a good way to describe it.
It's not just a line in the sand, I mean, it's a concrete 8-foot-high wall in the sand. And so the only alternative is to find somebody that is a full-time employee for someone else and hire that service. We can easily accomplish that with Reed. We don't have anybody like we did with Chris Simon, who has a bunch of employees that we can utilize. That's our dilemma.
I don't know if there's somebody out there another Chris Simon's out there, another Hartman out there, I don't know.
I don't know.
Not at the present point that I've been able to find.
See, I mean, it begs the question, which we've seen it historically in the school setting, where it's understood that even though you get a contract, if you're being funded by a grant and that grant goes away, then that position goes away. Council does not seem to grasp that. Don't ask me why, they don't. And that, I think the other side of that is both Richmond and county are self-insured, so there is a potential liability there, although you have excess insurance once you reach your self-insurance cap. It's a cultural thing, and I don't know that there's any rational way to explain it other than say that.
Well,
Council, as Dr. Jetmore said, council is adamant.
That was my question, because what then therefore happens, at least what we've experienced, is you have turnover, and then you have a lack of applicants, because why would one go and apply for a position that may not be there? It's not necessarily something that they get. So,
So getting back to reality, where are we on getting safety pins going?
Well, I think that we could talk to the council and see what they think.
We do have applicants for it now.
Well, no, because they're not posted, because we haven't had an independent contract to post that's legal, I guess.
Okay.
So essentially, I guess we're in the position of, do we continue to revise this independent contract to become compliant with the new regulations that came out in March, or do we start kind of refocusing and looking for another group to
Why don't,
subcontract?
didn't you say the Reed Hospital had a safety pin grant?
They're applying for their own safety pins.
Why don't you just tell them we've got the money for the safety pin grant and to partner with us?
Because that was in March, so they probably already have all their contracts and everything signed now.
But they may not.
Maybe not, yeah.
Well,
Well, it sounds
it
like
just
you-
seems, it seems a duplicated effort for Reed Hospital to have a safety pin and for us to have one.
There's
When we
several.
can, here's a chance, an easy chance for us to partner with somebody. And they have employees. So we avoid the whole contract employee thing.
The only reason why I know that that Reed was applying for safety pin is because the state instructed them to call to make sure that we weren't doing the same thing with our safety pin dollars. So they called and said, hey, you're not doing this with your money, are you? And I said, no, that's not what our contract is for. And they're not the only one who's called. So there's several other groups applying for safety pin grants in the county.
So for some of us, you might explain what the Safety Pins program
Okay.
is. And
So our FEMUR program is the fetal and infant mortality review. So we review deaths in fetuses 20 weeks gestation or older, and then infants 12 months or younger that passed away. And then the FEMUR team identifies gaps in the system that potentially contributed to those deaths, and then the safety pin team then implements change. And so our safety pin team specifically is focused on substance use, and we cover a 6-county area. And so we haven't, historically, FEMUR and safety pin were all together as one called the LIFE program, but now they're separated and the funding is separated. And our FEMUR team is already county employees, and our safety pin are not. It was written as contracting.
it's based on an attempt to reduce infant and maternal mortality, which we have a problem with. And the way he explained it, the other team has worked some and reviewed cases, but I don't think they've collated their data very well. But it's kind of like, for instance, I can tell you probably one of the leading causes of death of infants in this county is say unsafe sleep related. And we have all kinds of unsafe sleep related programs, but they're not necessarily coordinated. And I don't know if anybody's even taken, this is where the safety pins would come in, and they would look at it, why is that not working? And we've got safe sleep programs, but we've got a high death rate of infants dying in unsafe sleep situations. What's blocking it? Why is it not working? That would be the role of safety pins. They really should be together so they can be coordinated together. I mean, they need to work together on this, and then however we can come up with a system to do that. But right now, we've identified problems, so everybody's doing safe sleep stuff, but nobody knows how effective they've been, and what are the blocks? Why aren't people paying attention? Why are people ignoring it? Why are people still? We've even had cases where people give the right answers and do the wrong thing. I mean, it's why? But in our county, if you're going to lose a baby in the first year, unsafe sleep is the most likely way it's going to happen.
It's becoming more of an issue too. The chief medical officer of Reed recently reached
Now,
out.
marijuana's use in pregnancies tied into this too. Now, there's all kinds of issues. So I think we need to, it looks like our options are either to hire these people ourselves or to subcontract.
Yeah.
Does that seem the safest approaches?
Well, yes, but the devilish details are with whom do we subcontract, And again, a bona fide third-party entity is the safer route. We can try and play with the contract and get it as clean as we can. I'd given some suggestions to Rebecca that I overlooked one time footer being it says employment agreement. That was a duh. But I think I approved one of the contracts, so we can make it cleaner, less risk, and again, you're vulnerable because it only takes one dissatisfied person to file a complaint with the Department of Labor, and it's a possibility. We've been fortunate over the years that we haven't had it happen.
Well, I think the first step would be to make a case for them to be employees. If we get turned down, then,
We'll get turned down.
yeah, then we're gonna have to go find somebody to contract or come up with or contract, but warn them that the risk they're taking and by us coming up with a
Or
contract.
or give Becca time to track down Reed and see that if they even are available as a potential, because that would be a nice solution. Or B, look at what you're thinking about and seeing if you can at least fragmentize the FTE equivalent to you're keeping everybody under 29 hours. You could have 3 at 25 and get almost as much as your 2 at 40, or 3 at 29 and get a little more. And at least that puts a little sugar in the mix for the council because they're not on the hook for fringe benefits. Now could also then will impact the pool you have of applicants, because it'll be somebody that, usually a spouse that already has insurance, they don't need it. And that, I don't know how that would impact it.
Okay, so what we're saying is we need a little more time to firm up our options. Okay. Financial analyst report, visit report.
So our regional financial analyst for the central region of the state came to visit and look at just our processes and our accounts and things like that. This was prompted after the auditor came and spoke to you all. I requested that she write a summary from her visit just to present to you, and she was told by her administration that due to the ongoing investigation with our former contractor, she's not allowed to put anything in writing at this time. I told her I understood that, but she did verbally tell me that she thinks our processes are good, and she thinks that we have some good, efficient processes, I guess, in place. She requested that we update our inventory process and inventory anything that is valued over $500. So the three of us have kind of been working together to do that. She mentioned that Brittany excels in her physical documentation, physical paperwork, but there are some areas where she thinks she could be a little bit more organized in her electronic filing. So Brittany and I are going to work on that together. Overall, I felt relieved at her report. So maybe we can eventually get something in writing from her. Our monthly financial report is your purple polka dot tab. Oh, I'm sorry, does anyone have any questions about the financial analyst from Indiana Department of Health?
Sounds really positive. Thank you for following through with that.
Yeah, of course. So this purple polka dot tab is gonna be a monthly financial report that Brittany and I are gonna work together to provide to you every month. And Dr. Dretmore and I worked with Bob Coddington to kind of come up with what makes sense to present to you guys, to the board, in terms of relevant information. So you can see on the left-hand side, I've numbered all the accounts so that we can stay on the same page. The next column, I've put a real name of the account. Sometimes the names that are in our financial system don't really make sense. The fund number is the next column. The column after that is cash or reimbursable. So something that's important to know is that our reimbursable grants often operate in the negative because we spend the money and then we reimburse the money to the account. And the next one is the appropriation amount. So this is what we were told we can spend, whether it's in the account or not. We were told we can spend this amount. The cycle is the next column. So some of these are a 12-month cycle, some of them are a 24-month cycle, some of them are not on a cycle, like the 340B program, for example. That's our reimbursement for the hepatitis C treatment. that Dr. Jetmore's been talking about, there is no cycle on that because it's not a grant. Current cash is the money that's actually in the account. Available funds, so this one is, so for example, if you look at the appropriation amount and subtract what we've spent, that's available funds. So because some of them are reimbursable and some of them are cash, the current cash in the account and the available funds are gonna be different, if that makes sense. Next two accounts are ins and outs, or next two columns, I mean, ins and outs of the accounts, and then there's notes at the very end. So if you look at the very first one, that is our county health fund, or our 1159. That's one of the ones that we talk about all the time. We were provided an appropriation amount of $827,000, but because it's a cash account, that means we deposited $827,000 into that account at the very beginning of the year. So that's why the cash and the available funds are the same. And I'll let you guys look over it and ask me questions when you're done.
I think the information that you never had before was the cycle, you know. And I also think it's important to realize that, you know, in some of these we get a lump sum of cash, and the other ones we have to generate an expense, and then, as Becca said, wait for money to come to us.
Well, for example, go over the harm reduction one, where we got, what, negative in current cash?
So are you looking at line number 10?
Yes.
Okay, so that harm reduction, that's our HIV prevention. It is a reimbursable account. This is a little bit of a strange account. So it was supposed to end in December of 2023, and then they extended the time frame, and then they extended the dollar amount. So this was originally provided to us with an appropriation of $140,000, and then they provided us an additional $72,900, which is why that appropriation number is now $212,900. So with all of that happening, extension on time and extension on funds, there's some things that they got behind with reimbursing, which is why that current cash is a negative number. Our available funds for that, out of that $212,000, we still have $64,000 left to spend before July 31st of this year. And then you can see the monthly in and out. So monthly receipts, that was probably reimbursement from January or February because they are a little bit behind. And then monthly expenditures, $71,000, that would have been paying our 2 harm reduction contractors, maybe buying some supplies, things like that. And then notes, Brittany's put these notes in here for me just so we kind of know some of why these numbers are so crazy. So waiting on 2 reimbursements from 2024 and 1 from October of 2022. I don't know, but she's been chasing it around like a chicken with her head cut off.
I've been working on it since the beginning of 2023.
Okay, I got
At this point, I'm just determined.
Other questions on the financial summary?
Becca, do you know which ones of these, if any, have to be appropriated by county council?
So approved
Appropriated.
appropriations or?
Yeah.
I don't know. I know the auditor has appropriations for all of them. They contacted me probably, mid-February to make sure that we
At
had
least,
appropriations
yeah.
for everything. And so there were some accounts that had to be appropriated.
The 340B is the one I was really looking at.
Yeah,
That's
that appropriation amount is arbitrary. They just kind of kept pushing and pushing, and I explained that we're not really ever gonna know what it's gonna be, and so I asked them if they wanted me to appropriate based off of a percentage, and an end dollar amount, knowing that our physician assistant is contracted for this amount, and then afterwards, we might spend a certain percentage on different things, and they said no, just to pick a dollar amount, so.
Other questions? Thank you.
So, let's see.
We talked some about new job descriptions, administrative coordinator, you touched on that.
You've got 5 job descriptions between your blue and orange tab. I don't, how much of this do you wanna go over?
I think I've already gone over the high points of that. We want to, HR has all of these job descriptions. They'll all be full-time positions.
And do you think the council's going to approve them?
Yes.
Why would they approve these and not safety things?
As a full-time, why would they approve these full-time county employee positions? Well, the administrative coordinator, they already had Christine's been a placeholder for that.
So that's not an addition.
So
that's
Dan
a
and Beck,
placeholder.
so the jail navigator, I told him I'd pay for it out of the 340B money.
Okay,
Or the help, I say, whenever I say I mean,
that fund, the department.
yeah,
Oh.
I'm not writing a check for it.
We're gonna hold you to it.
Yeah.
It is
You say
being
physician's
recorded, huh?
assistant. David, you talk about David Wolf.
Yeah.
Okay, well, he's really a nurse practitioner.
Davis.
So, and the other one's David's position, which we will also fund. So that's why they'll agree to it.
And then you discussed Dan and Becca's,
What?
you discussed their new job descriptions earlier.
Yeah,
And,
so,
my apologies. I know at one point it was mentioned that Dave needs a raise.
yeah.
Is that somehow included in some of this somewhere?
Well, I haven't, I talked to him. You know, he gets paid hourly. He gets $65 an hour, and he probably could make $120 an hour. But I would like to make him a salaried employee. So, you know, I'm gonna, I wanna come up with something that's fair and fair for the marketplace.
Mhm.
But, you know, basically what's gonna happen, he's gonna have a lot of, you know, if I'm treating 6 jails full of inmates that have Hep C, you know, I'm gonna have to have people in these jails testing for HC or Hep C,
Mhm.
given pills, and he's gonna actually have to administrate all that.
Yeah.
So, I need to give him a substantial amount of money, more than he's getting. He's probably making $120,000 now. We probably need to give him $200,000. But I haven't ironed it out. I basically need to sit down and negotiate with him.
Human Resources has all 5 of these job descriptions, and I think that they're sending them to the salary analysis company too, so we kind of have to wait on their feedback as well. Any other questions on those?
Only other comment I would make with regard to the administrative coordinator proposal and hearing Dr. Jetmore. Throughout the course of this transition, I think we have seen and bore witness to the talent that sits across the table. I also, I think we all will never fall victim to being naive or naivete, but having that administrative coordinator help carrying such a load will only, I believe, maximize the efficiencies and effectiveness of the talent sitting across the table. At the same time, I think it would allow for such talent to realize and understand our appreciation for their skill sets and their efforts, and also help serve as a retention tool, because in this day and age, there are shortages everywhere, and rarely do you find such talent or have ease at finding such talent. So,
Yeah.
concur with Dr. Jetmore.
This is all Becca. Dan had no role in any of this. This is all Becca. So I keep my end afloat, and I keep my legislation and stuff moving forward, but this is all Becca. I provide input when asked.
But you're steadying influence. yeah.
I'm a big influence on anything I do in my life, Dave. I want to give credit where it's due. This was not a joint effort. This was Beckett.
You mentioned that femur Arian resigned.
Yes, she did. She, for personal reasons, she put in her 2 weeks notice. She was excellent. We're definitely gonna miss her. She's keeping her ears open for potential replacement, as well as her part-time community health worker is keeping her ears open. I have contacted the state to see if we can downgrade the position to an LPN if we have a hard time finding an RN. Not doing that by any means right now, just keeping it as an option. And they said that they do think that that would be a possibility if it takes us a while to get some qualified applicants or even any applicants at all at the RN. And I realize that would change the pay and we'd have to go to council and all that, but just maybe as a forewarning, I suspect it would be difficult to find.
And we discussed the independent contractor issues.
Yes, yeah, that's all discussed. Okay, Indiana Department of Health chose us as a hub, a pickup site for a new laboratory courier program that they're doing. So we're gonna be a regional hub, and so essentially what that means is they're gonna come to us and pick up our labs and take them to the Indiana State Department of Health lab. And then other health departments around us can bring their specimens by a certain time, and they're kind of organizing the process right now. And they are gonna have clinical and environmental components to this. We don't have a lot of information about it so far, even though it's supposed to start next week. They told us about it on Friday morning and then put a calendar training for us at 2 o'clock on Friday afternoon. So we're kind of flying by the seat of our pants on this, but we are excited to be a part of it because there is no cost to us. And they get all of our lab stuff taken. We don't have to pay postage and freight on any of that stuff anymore, so.
I think it's great.
Yeah, it's exciting. We're glad to be picked. We were picked because of our volume and because we're the biggest county kind of in this central location
And we
too.
have the storage capacity.
Yeah.
We have a full-size fridge in the garage, plus we have a mini fridge in the office.
So we got
Yeah,
capacity.
we could definitely hold it.
Yeah. And we have the budget to buy additional refrigerators if we need to, but that has kind of been discussed a little bit so far. The pink polka dot, I'm not gonna go over that one too much, but basically there's financial assistance available for lead abatement that is very, very recent. There are scholarships for homeowners, there's reimbursement for contractors. It is income eligible, and my understanding is that it's a set number of homes for the 2 different programs. And so our lead environmental health specialist has been kind of informed on that process, so he can talk to people who might need the abatement assistance. MOUs with surrounding counties. The state contacted us and asked us to provide services for lead risk assessments in Fayette and Union counties, and then also STD and STI testing in Fayette and Union County at the health department. This is separate from the jail program. And we requested to have MOUs because both of those programs can be very expensive because the STD, STI tests are $20 to $30 a piece, and then the lead RXF machine has to be serviced right now about every 24 months, and it costs us $10,000. So we're not by any means going to give these services away for free or fund them with our own Health First Indiana dollars. So I know the director of the state harm reduction program has asked to sit down and talk about the MOU for the harm reduction MOU with all the state programming and administration from all the other counties. But they are under the understanding that they are going to use their own Health First Indiana dollars. They're going to buy their own tests. And I've even discussed paying travel time, mileage, things like that for any of our people that go over there. Dan's been working on the lead MOU or the lead process, and we've been talking about a fee for service for every risk assessment. They don't expect that it's going to be very many, at least, from what they told us, but we have to have the meeting first to find out.
Do we have the personnel to do it?
It depends on how much they would need, I guess. Right now, if we did maybe once a month in Fayette and once a month in Union, we do have the personnel, but if they expect us to come once a week, then no, we don't have the personnel. So we have to kind of find out what their expectations are.
On the lead end, I do have the personnel. It really depends on what that county is asking from us. Preliminary, they want us to go down and do a risk assessment, and then they would have their own health assessment done by their own medical staff and reporting by their own staff. If they require us to come back and do clearance and other things, I have the staff, but I would have to ask for a larger reimbursement than what I originally asked for, more drive time. Of course, this is all preliminary. We have to make sure that we're able to get a commissioner approval to take the vehicles across county lines for, technically not county business. So I do have the staffing on the environmental side to cover that if need be.
Okay, so that's just kind of to keep you updated thing, to let you know what they ask for and if we even think that it's realistic. Immunizations, we have been targeting areas who have target populations of individuals who are 65 plus to get clinics scheduled, and I think we've got 3 scheduled so far. Our school liaison, who's also kind of our immunization, he is our immunization coordinator, has been kind of spearheading that. We had our immunization quality, I can't remember what IQIP stands for right now, but we had our immunization quality site visit at the beginning of April. We discussed some new goals for the immunization team, and it went really well. Our immunization rates, as I think most of you know, are excellent. And so we're kind of discussing some new initiatives. One of the things that we're going to try and focus on improving is our HPV immunization rate, because we are not so great in that area. School liaison program update. We have been trying to get some kindergarten roundup vaccination clinics. Last I heard from him, I think we had 2 scheduled. The school liaison school liaison program is ending at the end of June. However, we have a substantial amount of funding in that account, and will receive an additional $164,000 over the next 2 months. One of the deposits was supposed to be this week, so it may already be in there, but $256,000 the last time I looked, and then another $164,000. So I essentially asked the state if we get to keep that money, if the money goes back to them, and this program is unique in the fact that we do get to keep the money. However, I pasted, oh no, I guess I just have this online, I don't think you guys have this. The state person who's over this program suggested to purchase emergency medications, AEDs, feminine hygiene supplies, stop the bleed kits, CPR training for staff and students, and then she said she can provide some other thoughts, but essentially she said we can continue the school liaison program if we would like to do that, because we do have quite a bit of money in there. So I wanted to see if you had any thoughts or feedback before I kind of start pricing out some of the things the schools may need, like EpiPens and albuterol and things like that, because that's what she recommended to use the money for. Any specific thoughts on that?
So I assume you've asked the schools what they think they need?
Yeah, we're gonna ask what they need. And there's 2 different weight classes for EpiPens, so we'll kind of ask, do you need both weight classes of EpiPens? Are your EpiPens expired? We're not gonna buy 10 EpiPens for a school or something, but decide.
So is it entirely emergency type equipment we're talking about? Because the EpiPens, of course, if you have an anaphylactic reaction, I assume albuterol is added in an acute status asthmaticus attack. Are they asking for diabetic supplies? If
No.
someone comes in diabetic?
In her email, she's talking about a lot of emergency supplies. She did talk about hygiene products. We have supplied like pads and tampons and things like that before. So it's not always emergency supplies. Things like deodorant. I think we've provided some lice kits before. So not necessarily, but I think she's talking about more big ticket items, because the EpiPens are expensive, the AEDs are expensive. So she's talking about, well, you have this large lump sum of money, maybe doing something like that.
Well, I know head lice is something that panics the school and the teachers and the parents.
Yeah. I don't think,
That's
I mean, correct me if I'm wrong, but I don't think they're allowed to administer the lice treatment,
Yeah,
but they can
we-
provide it to
can we
them or
provide it so
something.
they send it home, or we
Yeah.
can't do that?
I was under the impression they can. Is that true?
Yeah, in the schoolhouse, we try and do what we can.
Okay.
It is bad, but I'm curious, could such funding and, is this just for resources, tangible resources, or could social emotional supports or those type be utilized with such funding, or is that not?
I'd have to
this is
look
smart for?
kind of specifically at the KPIs for it. It originally was staffing two school liaisons, and the idea is that it connects the schools to the services that they need. A lot of screenings, and then vaccination connections, and then basic health needs. So that's kind of why, like, the feminine products and things like that. But they recommended keeping a full-time school liaison with that funding.
I
But
didn't know if you used for counseling services or such personnel.
I don't know. I can look into it and see what the.
Yeah, find that out. Is that one of your needs?
Oh,
Definitely.
tremendously, yes, sir.
What are some of the other things that come to mind?
Staying in that particular vein, we do not have school counselors at our elementary levels. We don't have a school counselor per schoolhouse.
Ask them about school counseling.
Yes.
What
and then,
else?
When it comes to those extended and expansive social emotional supports, we are partnered with Centerstone, and they've provided inadequate services for some time. But that's what, especially from a standpoint of those students who come to us from parents who may have been participating in particular levels of abuse. Those students are really, their needs are greater than some of our other students. So anything to help try and combat, and that's just, that definitely be appreciated.
We'll look into that.
Yeah, appreciate it.
Other comments? Okay, what else have you got on yours? Is that, are we ready for environmental supervisor?
My last thing, CPR. The commissioner, well, the county has asked for CPR training to be provided. I'm currently the only certified CPR instructor, so the Indiana Department of Health has offered to step in to provide CPR training until we get somebody else certified as an instructor, so that we can get that done. Okay, Dan has one thing, I think.
I've actually added a few.
You have
but
2
it won't
seconds.
take me
I'm
very
sorry.
long. It won't take me long at all. So sitting before you is the new ordinance that was approved by the state finally. That the State Department of Health will pass the TRP this time. It is merely just contractor registration. So all I'm asking is that the contractors register with us as the county health department. They pay a fee every year, and this fee has been in place for the last 20-some years. I mean, it's nothing new to the contractors. And the reason that I would like to have registration is so I know who's working in the county. I have biannual meetings with the contractors. If there's changes in legislation, I send it to them via email. And if I don't know who's coming into the county to work, I can't get this information out to these contractors and have the meetings and trainings that I put on. All I could do is merely advertise it through social media or the newspaper or radio and hope I have people show up. So that is the reason I would like to have registration. I've spoken to a few of the county contractors, and they also prefer it. Even though they're the one fitting the bill for it, they prefer to pay it because it gives them a little stake in the game, and they don't have somebody coming from 60 miles away to come down here and take business from them that doesn't have any stake in the community itself. So if it makes it to public comment, I'm sure a few of the contractors would be in favor of it. But I'm looking for your permission to move forward, to go to the commissioners basically with it.
I like the part where you're requiring them to stay up to date on techniques in
Yes.
manufacturing.
Yeah, new technology
Definitely new
into
technology.
Indiana. There's several technologies. There's ATU, which is aerobic treatment units. There's secondary treatment units, which is chlorination, UV light, things of that nature. There's a lot of technology that's coming to Indiana, and part of that legislation that passed last year gives a homeowner a right, last opportunity or last chance basically, is you can have a direct discharge system now. So you can go from your septic tank to another tank with a secondary treatment, and you can dump your sewage right onto the ground. And there's certain requirements, and that's never been before, there's certain requirements with that. So that is stuff that I like to keep the contractors up to date on, you know.
Other questions? Call for a motion to approve.
So moved.
Second.
Second.
All in favor? Aye. Opposed?
And just some more FYI for the board. Our new employee, Timothy Croucher, started in February. He's being trained pretty well right now. I also sent him to Purdue. He just finished up last Thursday. He's got a Category 8 license, which means he is now registered with Purdue and licensed by the state to apply insecticide and pesticide on the Category 8 level. And what that does is that helps us with our mosquito control problem. When we have complaints, we're able to apply that pesticide. We're having a court appointment this week for a housing case, the house just south of the actual health department there. So we'll know the first appointment's Thursday or Friday, I believe, and then another appointment in May. So hope to have that resolved here before long. There's updates to the new food code, or there will be a new food code, so that my inspectors are being trained on that right now as well. It's not passed, so not quite yet, but they're hoping for it to pass by July 1st. And then an issue I just actually dealt with today, I just thought I'd let everybody know. On Centerville Road South, there's about 5 homes on the west side of the road, all about 1 acre lots. Behind them is a farm field. That farm field sold to a new owner back in 2021. The new farm owner realized, hey, some of their backyards are actually on my farmland, and tilled it all up, tilled right through their septic systems. So I just got a positive dye test today on 1 septic system, and I'm unable, a couple of the other neighbors won't respond to me. I've knocked on doors, sent letters, I can't get them to respond to me. So I'm assuming there's a minimum of 2, possibly 4 to 5 septic systems that have been cut through. So that may turn into a bigger mess. So I wanted to make you guys aware of that, so the board aware of that.
It's the board.
It's the board.
He's
Any
teaching
questions
us.
for Dan?
Learning.
Any old business? I think we've had a lot of new business.
A lot of new business.
Next meeting is May 21st at 12. I would entertain a motion to adjourn.
So moved.
Second?
All in favor?
Aye.
Opposed? Thank you, everyone.